Welcome to the Direct Data Entry webinar training for professional claims submitted through the ProviderOne portal. We are conducting this webinar due to the policy change at the Washington Healthcare Authority, where we are no longer accepting paper claims unless you have an approved waiver. This was implemented on October 1st, 2016, and we are hoping to reach those providers who have only submitted paper claims and need to transition to electronic billing. This training will focus on billing electronically through the direct data entry system in ProviderOne and will not cover HIPAA or EDI claims. For more information on HIPAA billing, please visit the following webpage, www.hca.wa.gov/billers-providers and click on the third link under the blue claims and billing bar titled HIPAA Electronic Data Interchange. I am Matt Ashton here with my coworker Marcy T.G. We will be reviewing our PowerPoint slideshow first and break down each field required to submit the claim, and then show a live demonstration of entering a professional claim through ProviderOne. Any questions received during the webinar will be collected and answered to those questions will be posted after the webinar, along with the recording of this presentation. Only questions related to the direct data entry billing will be responded to. After this training, you will be able to submit fee-for-service claims through the ProviderOne portal and submit claims for clients who have commercial insurance. Before we get started, there are some important settings on your PC that need to be verified before you begin. Make sure your pop-up blockers are turned off. The process to turn off pop-ups is different depending on what browser you are using. ProviderOne uses pop-ups throughout the claim form, and it must be turned off to finalize the claim. ProviderOne is a HIPAA compliant program that gives you the ability to enter claims directly into the payment system, and all fields that can be entered on a paper claim can be billed through the direct data entry. It is easy to use and does not cost anything to do so. As long as you have the correct profile and access to your domain in ProviderOne, you can bill as many claims as needed using multiple PCs if necessary. You can correct and resubmit denied or voided claims, or adjust or void previously paid claims. Corrections and resubmissions will not be covered during this session. However, the contact information on the last slide if you need to reach out for assistance on these functions. Once you have entered your domain, username, and password, you need to choose a profile. There are several profiles that allow for claim submission. The most frequently used is the EXT Provider Super User Profile. This profile allows the worker to do all the functions in the system except for managing user permissions. If the incorrect profile has been chosen, ProviderOne gives you two ways to change it, by either using the My Inbox tab or dropdown, or by hovering over the username in the upper left corner of the portal. For this session, we will choose the EXT Provider Super User Profile. Once you have chosen the correct profile, you would then choose Online Claims Entry from the Provider portal. You would then choose the claim type you would like to enter. A professional claim submission would be the same as a CMS 1500 paper claim form with all the same fields available for entry. Here is a snapshot of the first half of the direct data entry screen. The claim itself is broken down into 4 different sections: billing provider, subscriber or client information, the claim level or header information, and the service line level. There are also some basics on navigation that we should discuss. Do not click your back arrow on your browser, but use the hyperlinks and buttons on your screen itself to navigate. You also must complete any question or field with a red asterisk. And if you expand an area by clicking any of the red plus signs, you must either enter the detail required or close that area by clicking on the minus sign. Otherwise, ProviderOne will be looking for entries in these expanded areas. Here is the second half of the claim form showing the required entries. We will break down each section and show each field and what is required to submit a claim. Let's start with section 1, the provider information. The first thing to do is tell ProviderOne who the billing provider is by entering the National Provider Identifier, or NPI. The billing provider is where payment will be sent to or who is getting paid for the service. You will also need to enter a taxonomy code that is attached to the billing NPI and applicable to the service you are billing for. The taxonomy code tells ProviderOne what type of provider is submitting the claim. Note the red asterisks as these are required entries. Now you have come to the first question that must be answered. Is the billing NPI or provider also the rendering provider? This represents the provider actually performing the service. If you answer this question yes, you are saying that you are both the billing provider and the provider rendering the service. Otherwise, you would answer this question no. Answering the question no opens up the rendering or performing provider area where you would enter the NPI and taxonomy for that provider. This is the second question ProviderOne will need to answer. If the service was not the result of a referral, you would choose the no radio button. If the answer is yes, you would enter the NPI of the provider who referred the service. That completes the first section, and we are now in section 2, subscriber or client information. This is where you will tell ProviderOne what Apple Health client received the service you are billing for. This is the ID number noted on the ProviderOne services card that each client receives. You must enter the WA, but it does not need to be capitalized. The next step is to expand the additional subscriber client information by clicking on the red plus sign. This is where you would tell ProviderOne the Apple Health client's name, date of birth, and gender. You will note that the first name field is not required or marked with the red asterisk. This information must match what is in the client's file in ProviderOne. There are also some fields that are not required in this section, such as date of death, patient weight, and patient is pregnant, so those can be skipped. The next required question that you must answer is related to billing for a baby using the mom's ID. If this is the case, you would use the mom's client ID, but enter the baby's name, date of birth, and gender. The next required question is related to the clients with Medicare as their primary coverage. If Medicare made a payment, whether it is a copay or a deductible, for example, these are considered crossover claims, and you would answer the question yes. It will expand the crossover area, and you would enter the total amounts paid for the claim in these fields. Each box must have an entry noted, even if it is a 0, as these are required fields. If Medicare did not make any payment or apply to the deductible, etc., you will answer the question no, and Medicare explanation of benefits must be submitted with the claim. If the client's Medicare coverage is a Part C or managed Medicare plan, these are not entered as commercial insurance claims. The same billing rules apply for Part C plans as do regular Medicare claims. If the Apple Health client has a commercial payer as the primary insurance, you will need to complete the other insurance fields by clicking the red plus sign to open this section. Click the very next plus sign for other payer insurance information. Skip down to the other payer information box and enter the commercial payer name. Once complete, expand the red plus additional other payer information section. Only two fields are required here, the ID and the ID type dropdown. The ID needs to be the insurance carrier code that is listed on the client's eligibility file, which we will show on the next slide. And the ID type dropdown should always be PI for payer identification. This is a snapshot of a coordination of benefits segment from the client eligibility screen where you will find the insurance carrier code or the ID number from the previous slide. If you need more assistance on finding the carrier code in ProviderOne, please review our fact sheet titled Successful Eligibility Checks Using ProviderOne at the web address noted on the slide. The next entry is to tell ProviderOne how much the commercial insurance paid by entering the amount in the COB payer paid amount field. This amount can be entered without decimals if it is a whole dollar amount. If the insurance denied the service, you would enter a 0 here. ProviderOne requires the use of HIPAA-compliant adjustment reason codes. These codes will be entered by expanding the claim level adjustment section. Once expanded, you would enter a group code, reason code, and dollar amount applicable to the reason code entered. The HIPAA-compliant reason codes can be found at the WPC's website at the address noted in the green box. The next section to complete is Section 3, Claim Information. This is also called the claim header detail information that covers the entire claim. The first area for entry is the prior authorization section. You would click the red plus sign and enter it here if the services you are billing for require a prior authorization or an expedited authorization number or EPA provided in the program billing guides. If no authorization is needed for the service, skip this area. Entering the authorization or EPA number here would apply to the entire claim. If you have more than one authorization number to bill with, this will be covered later in the slideshow. Recent system changes to ProviderOne have changed how claim notes are read. If a specific program or service requires you to enter a claim note as instructed in the program billing guide, then it will still be read by ProviderOne. If no claim note is needed, skip this option. Here is the last required question on the professional claim form. You will always answer this question, is this claim accident related, as no. If an Apple Health Medicaid client has a casualty-related claim, it is handled by a specific unit in our Coordination of Benefits office. The next field under claim data is for the patient account number. This is not required, but can be used by your office to identify the client using your own identifier. This number will be carried forward to the weekly HCA remittance advice to assist in reconciling accounts. The next entry is to choose your place of service. Most often you are choosing office, so you can use the number 1 to easily jump down to the place of service 11, or use the drop-down to select that from the list. Additional claim data is needed only if the Apple Health client has a spend-down liability they owe that needs to be reported on the claim. You would choose the red plus sign and enter the liability amount in the patient paid amount field. Professional claims require at least one ICD-10 diagnosis code. With HIPAA implementation, you can enter up to 12 diagnosis codes if needed. Do not enter decimal points, as these are added automatically by ProviderOne after submission of the claim. If a decimal point is entered, you will receive an error from ProviderOne when you try to submit the claim. That completed Section 3, and now we will review Section 4. Basic service line items, again covering each required entry. The first required fields are the from and to service dates. These must be entered in complete digits as noted on the screen, such as using a 4-digit year. ProviderOne allows you to also enter a place of service at the line level. However, this is not required. If you want to enter it here, use the drop-down to select from the list. Next up is entering the HCPC or CPT code from the most current coding manuals. If these codes require the use of a modifier, enter one modifier per box up to 4. The next field to complete is the submitted charges. We always recommend that providers bill their usual and customary amounts here. However, if the service you are billing for required a prior authorization, you must bill the amount that you requested. Next, you need to tell ProviderOne which diagnosis code goes with the procedure you are entering. This is done by using the diagnosis pointer dropdown. The numbers in the drop-down boxes correspond to the diagnosis boxes you entered above. What you entered in box number 1 is considered the primary diagnosis for that specific line. Each procedure you entered will require units. Enter the number of units in this field. If the Medicare question was answered yes at the claim level or header area, you must expand the Medicare crossover items at line level by clicking the red plus sign. Enter the payment amounts from the Medicare EOB specific to the procedure you are entering for the service line. Every box must have an entry noted, even if it is 0, as these are required fields. The amounts billed at the line level, when totaled, must match the Medicare amounts listed at the claim level or header. If the service is for an injectable drug, the National Drug Code or NDC is required. The NDC code must be entered in a specific format which is described in the Physicians Related Billing Guide found on the HCA website. The drug identification area is not required and can be skipped. If the authorization number for the procedure being entered is different than the one listed at the claim level or header area, click the red plus to expand the prior authorization area and enter that number here. Once you have entered all the required information for the service line, click the Add Service Line Item button to add the service line to the claim. It will remove the information from the service line area and populate the claims below the gray bar, similar to a CMS 1500 claim form. If there are additional service lines that need to be added to the claim, you can quickly return to the service line area by clicking on the service hyperlink shown here and follow the instructions from the previous slides. If the service line was entered incorrectly and needs to be updated, you would click on the service line number. This will repopulate the service line boxes for you to make any corrections. Once your changes or corrections are completed, click on the Update Service Line Item button to add the service line back onto the claim. If you added a service line in error and now need to remove it, you can simply click the Delete hyperlink to the right of the service line, and it will delete the service line and return you to the top of the claim screen. Once all service lines have been added and you are ready to submit your claim to ProviderOne, click the Submit Claim button at the top of the screen. If your pop-ups are turned off, you will receive this dialog box. If you have backup documentation that needs to be attached to the claim, click the OK button. Simply click the Cancel button if there is no backup being sent. If you had no backup to attach and you clicked Cancel on the dialog box, you will come to the Submitted Professional Claim Details page. This provides you with your claim number and a summary of the charges being submitted. When you receive this confirmation screen, this means ProviderOne has all the required data needed. To finalize a claim, you must hit the Final Submit button to send it into ProviderOne. Once this final step is complete, you will be returned to a blank claim form. If you had answered OK to the question, do you want to submit backup to this claim? You have the option of attaching the backup directly to the claim. To do this, you would use the drop-down for attachment type and select the appropriate option from the list. Then you must choose a transmission code from the next drop-down box as EL for electronic only or electronic file. Skip the line number box drop-down completely. You can then click the Browse button to search for the electronic file you want to attach to your claim. Once attached, click the OK button to return to the Submitted Professional Claims Details page. Scanning and attaching your backup electronically could result in quicker processing and adjudication of your claims. If you are faxing or mailing the backup documentations, complete only the attachment type dropdown, and the transmission code dropdown will be either BM for by mail or FX for fax. Click OK to return to the Submitted Professional Claim Details page. If you are choosing to mail or fax your backup documentation, you must create a cover sheet so that it can be matched up to your claim in ProviderOne. The information noted on this screen is used to complete the required cover sheet. Click the Print Cover Page button. This cover sheet will come up as a separate screen from ProviderOne as a PDF file. Complete the first drop-down to choose the provider ID, NPI, and enter that number in the provider ID field. Tab to the TCN field and enter the claim number you received on your Submitted Professional Claims Detail screen. Tab to the Data Service field and click the drop-down to bring up the calendar. Use the calendar to choose the date of service you are billing for. If there is more than one date of service on your claim, you must use the earliest or oldest data field in the screen on this field. Tab to the ProviderOne Client ID field and enter the 9-digit ProviderOne Services Card ID number, including the WA. You will need to tab twice after entering the client ID to expand the barcode so that it can be properly read by the ProviderOne scanner. Click the Print Cover Sheet button and either mail or fax in the backup, depending on what option you choose on the backup screen. Your direct data entry claim will be held for 3 to 5 days waiting for the backup to be received to attach to the claim. Now that you have completed the cover sheet for your backup, you must click the final Submit button to send your claim to ProviderOne for processing. Once this final step is complete, you will be returned to a blank claim form. This slide provides some useful links for accessing resources on the new Healthcare Authority website and for submitting questions on submitted claims through our Contact Us form. We have now come to the end of the slideshow portion of entering a professional claim using the direct data entry feature of ProviderOne. Now I'm going to demonstrate entering a live professional claim using the same process.
Hi everyone, this is Marcy here. I'm going to narrate for Matt as he walks us through the direct data entry screen. Once you have accessed ProviderOne, you will need to select the appropriate profile for submitting claims. Matt's going to choose the EXT Provider System Administrator profile from the drop-down list. Next, he will choose the Online Claims Entry option on the provider portal. You will notice he received an error telling him he does not have sufficient rights to access this link. After clicking Close on the error page, Matt is going to demonstrate how you can change your profile from the provider portal screen. He will click on the username in the top left of the screen and hover over the listed profile. This will bring up a list of all the profiles assigned to the user. Matt will now choose one of the correct profiles for submitting claims. the EXT Provider Super User Profile and click Yes when asked to confirm the change. Matt will now click on the Online Claims Entry option on the portal. This takes you to the claim submission screen where Matt will choose Submit Professional. The first required field Matt will complete is the NPI and taxonomy code for the billing provider. The first required question is the billing provider also the rendering provider? Matt will select the No Radio button. Matt will now enter a rendering, performing, or servicing provider NPI and taxonomy code. You will notice that ProviderOne moves the cursor for you from field to field. The next required question Matt will answer is this service the result of a referral? He will click the No Radio button. Next up is telling ProviderOne who the service was provided to. So Matt will enter a client ID number from the ProviderOne services card using the WA. For this demonstration, this is a generic ID for test purposes. Matt will now expand the additional subscriber client information area by clicking the red plus. He will enter the last name, date of birth, and gender. The next required question will be completed. Is this claim for a baby on mom's client ID? Matt will answer no. He will also need to answer the next question. Is this a Medicare crossover claim? Matt will again click the No Radio button. For purposes of this demo, we will skip over the next 5 red plus signs and answer the last required question. Is this claim accident related? He will click the No Radio button. The next field is the place of service drop-down. Matt will click the number 1 to choose office. The diagnosis fields are next, and he will enter one in without any decimal points. And in case you were interested, this is one of the new ICD-10 diagnosis codes for struck by a duck. After diagnosis, Matt is now in the service line area, and he will enter the from and to dates. He will skip the place of service since he entered it above and move to the procedure code field. Matt's going to enter a 99213 for an office visit. If a modifier was needed for your billing, this is where you would enter the modifier. Matt will now enter the submitted charges. The diagnosis pointer is next, and he will choose 1 from the first drop-down. We need to enter the number of units we're billing for, so he will enter 1. Because this is a simple office visit, we are skipping the remaining plus marks and fields, and Matt will click the Add Service Line Item button. He will use the service hyperlink at the top of the claim screen to return to the service line area to verify his entries. Matt is happy with his entries, so he will return to the top of the claim screen to submit the claim by clicking the Submit Claim button. ProviderOne is asking if there is any backup documentation to attach to the claim. Matt will click Cancel. This is a good time to make a note of the TCN or claim number assigned to your claim for future reference, and you can verify the dates and billed amount. Matt is going to finalize this claim by clicking the Submit button in the bottom right corner. The system returns you to the top of the claim form and clears out all the information entered. The claim form is ready for you to submit another claim if needed. This completes the live demonstration of submitting a professional claim through the Direct Data Entry feature of ProviderOne. So it doesn't look like we have any questions to answer at this time, so we're going to go ahead and end this session. Thank you so much to the 2 attendees we had. And we'll make sure that we post any questions and answers we do receive along with this presentation on our ProviderOne Billing and Resource Guide webpage.